Hi, it's Adrian Kat from Advanced Dental Artistry here in West Perth. I'd like to talk to you today about porcelain treatment. I suppose when we're talking about porcelain treatment, we're really talking about cosmetic treatment. And in cosmetics, we use porcelain, either crowns or veneers, to enhance the smile and to create a beautiful smile. One of the questions we so often get is, what's the difference between a porcelain crown and a porcelain veneer? If you type into porcelain crown and images in Google, you will normally come up with this diagram, which actually shows that in order for us to create a porcelain crown, we need to remove at least 1 millimeter to 1.5 millimeters off the entire tooth. So what we're doing here is we're replacing the tooth enamel. We're removing all of that tooth in order to use the porcelain to replace the tooth enamel. This should only be done really if the tooth is already weak. So that meaning that you've lost maybe 50 or 60% of the tooth to filling, and the tooth that remains is too weak to actually do more conservative treatment. When you look at images of teeth that have been prepared for porcelain crowns, you can see they've removed a lot of the tooth. So what we really try and do these days is to be conservative and to not do this. We want to preserve as much natural tooth as possible. So if we need to do a porcelain crown, this is one of the crowns from Libby, our technician, you can see how beautiful the crowns are though. You can see that she's really taken the morphology and the staining of the tooth to make it blend into the natural teeth. If you look at how she actually creates a porcelain crown, a lot of work goes into creating a porcelain crown. It needs to be one pressed, but then it also needs to be stained and glazed. So what happens if a patient comes in with needing a cosmetic change but has sound teeth? We really want to be as conservative as possible, and if possible, actually do very little drilling or no drilling at all. When Christy came to see us, she came to see us because she didn't like the colour of her teeth. She didn't like how her canines were very prominent, and she didn't like how the teeth weren't all the right level. She also had some white staining on the front of her teeth. What we do is we then can use porcelain veneers. And porcelain veneers, again, there's many different types of porcelain veneers. The idea is to always be as conservative as possible. So use the thinnest porcelain, so therefore doing the minimal amount of drilling on the teeth. So we take a model of her mouth and we design a smile. So Libby will actually sit down, and with our digital smile design, she will use wax in order to actually create a new smile. We can then take a key or a template of that wax, and then what it will show us is that it will show us exactly how much tooth we need to remove in order to create enough room for a porcelain veneer. Generally with veneers, they need to be about 0.2 of a millimeter. So you can see in these areas, we actually do have enough room, except in this area here. So in that area on that lateral tooth, I do need to remove a tiny bit of the tooth in order to give enough space to place my porcelain, but it's very minimal preparations. What you can see here is one of the porcelain veneers that I'm holding up with my finger against a candle, and you can see the light coming through. So that means that the porcelain veneer is very, very thin. So it's very aesthetic because we can stain and glaze and change the shape, color, dimensions of the tooth, but it's also very conservative because we don't have to remove any or much of the tooth at all. So you saw the photo here, Christy before, and this is her photo after. What are the problems with porcelain? Well, if porcelain's not done well, there's a number of issues. One is the material. For example, with a case like this, you can see obvious changes from the porcelain to the tooth, and this is what we sometimes call grey or black lines above the porcelain. And this is because these are the older type of porcelain where they used to use metal and then fire porcelain over the top. When they did that, one of the problems is the metal used to corrode, so it used to create a lot of black areas, and some people were sensitive to the metal, so the gums used to recede or lift away. So we ended up showing these margins, and that's one thing that patients definitely don't like when they smile, is seeing those grey lines or those lifted margins. It's the same if the porcelain is the wrong type of porcelain, or the bite isn't taken into consideration, is that porcelain will chip. So for example, if someone's a grinder or a clencher, we sometimes need to use things like night guards in order to protect the porcelain. If the porcelain is the wrong type of porcelain, also we will see chipping of the porcelain over time. And this usually happens about 3 years after porcelain. Given that most porcelain should last around about 15–20 years, this is a very short time before we actually saw porcelain failure, in this case that was done in Bali. The other aspect is actually shade matching. Shade matching is really important when you're doing a small number of units. If you're doing, say, one front tooth or maybe 2 or 3 front teeth, the Main objective is to make sure it blends in with the rest of the teeth. So shade matching or getting a proper shade is important because we need to make sure that it's in harmony with the rest of the teeth. So you can see this crown here was done, and you can see not only is it the wrong color, but it's also the wrong size. So how do we overcome some of these problems? Well, we have on-site technicians, and we've got Libby, who's been a technician for almost 30 years, and she's been working with me for a long time. And what we do is, as a team, we design smiles and we design the actual porcelain. This is some of her work on some of the front porcelain veneers, and you can see it can sometimes take up to 3 to 4 hours just to create one porcelain veneer. A lot of staining and glazing goes into that. This is actually a very close-up view of the porcelain, and you can see how beautiful they actually look. They really mimic the natural nature of the tooth, and also make sure that the overall cosmetics is actually correct. One of the important things on our website is that all of our photos and all of our cases are actually patients that have been treated at Advanced Dental Artistry. We never use any stock photos. So if you have any questions, please give us a ring on 1-800-SMILING. We offer complimentary discussions to talk about any of your dental needs. You can email me directly at dradrian@adaperth.com.au. I look forward to seeing you in the practice.